Good afternoon.
Okay, you can go ahead and start.
Okay, good afternoon. I'm Dr. Thelma Choma Ibokwe. The practice optometry of St. Emmanuel Hospital is Solo, Lagos State, Nigeria. Um, on the spirit of our 50th anniversary, I'm here to educate us on the topic, do I need glasses? Why glasses are needed? Please, can you take it to the next slide? So introduction. Most time people wonder why we can see clearly without glasses and why others never need them. Today, let's learn on how our eyes are focused, what visual problems happens, and how glasses are being needed. Next slide. So how does the eye work? We say the eye is the camera of the body whereby light enters through the cornea and the lens, focusing on the retina. When the focus is perfectly heated on the retina, every individual tends to see clearly. Any small focus error can cause blurry vision or diplopia. We have different common vision problems like myopia, hyperopia, astigmatism, presbyopia. Do you know how this works? Myopia, as you all know, as the nearsightedness. We also call it a refractive error in which the parallel rays of light focus in front of the retina. These are the results of the eyeball being too long or the cornea being too curved. So let's talk about hyperopia. Hyperopia is also known as far-sightedness. Some people say I have far vision. It's a refractive condition in which parallel rays of light focus behind the retina instead of focusing directly on the retina. This is as a result of the eyeball being too short and the cornea being too flat. We have also astigmatism. People wonder how this happens. Sometimes a lot of patients have visual problems, signs and symptoms like I can't see near objects, they look distorted, they look blurry, and all that. So let's know the pathophysio in responsible of this. Astigmatism is a refractive error that occurs in the lens and the cornea as an irregular curvature, causing light rays to focus on multiple points of the retina instead of focusing on a single point. This focus on a multiple points. These are the result of both near and distant objects appear blurred and distorted. We also have presbyopia. Presbyopia is the age-related physiological refractive condition caused by the lens flexibility and ciliary muscle weakness when ciliary muscle is weak. This happens to people who are at the age of 40 years, but most people start experiencing these symptoms at early 35. We call them early presbyopia. So how can this refractive error be attended to? This can be corrected by glasses or the use of contact lenses. Signs that you may need glasses: blurry vision, both near or far, frequent headache or eye strain, difficult reading or seeing the boards, squint or rubbing often of the eyes, avoid reading, or people who avoid driving at night. These are signs that one needs help, the tendency of them having refractive error. And people mistake this. When the patient is presented with refractive error, the only solution is glasses, contact lens, or refractive surgery that is needed. Eye drops are not needed in these conditions. Can we move to the next slide, please? Importance of eye examination. Why should you get your eye tested? Only comprehensive eye tests by an optometrist can confirm if glasses are needed. Yearly vision screenings helps to figure out or detect early refractive changes on individuals. So thereby, we advise that every individual should get their eye tested 6 months, 1 year. Children and adults over 40 years should get early year eye examination. This is important. This enables individuals to also know if glasses are needed or not. And not only glasses are needed, it also helps us to detect early pathological issues like glaucoma assessments, diabetic retinopathies, and all that. Glasses are not just for vision correction only. Yes, people say, why should I wear glasses? Glasses are not just for vision correction. Glasses can serve in different areas of life. They serve as a protective lenses, whereby they help to block blue light and UV rays of light. Especially for digital workers, they need glasses always to help them prevent them from radiation that emanates from their laptops or their gadgets. Safety glasses. It helps for people who are into industrial aspects of life to protect their eyes, and also for outdoor activities. Glasses can also be fashionable. It can help boost your confidence and your styles. So prioritizing glasses is also a very good way of protecting your eyes. It helps you save accidents, ocular accidents, or ocular emergencies. In conclusion, if you notice any change in vision, do not guess, get your eye tested. Glasses aren't weakness, they are a tool for clearer vision, healthier vision, and also a good way of living. Seeing clearly means living fully. In conclusion, we are still running our 50 years anniversary free eye screening, holding at St. Emmanuel Hospital in Solo this Saturday, time by 10:30 a.m. to 5 o'clock, 5 p.m. Saturday. I would love to see you there. So to round it up also, St. Emmanuel Hospital have other specialties apart from the eye. We have dental clinic, we have the lab, we have the eye clinic. But the eye clinic consists of the optometrist, which is Dr. Thelma, and also the ophthalmologist, which is Dr. Bumi Bello. We consult you anytime you need a good eye check. We have the ophthalmologist consultation. Also, we have the ophthalmologist consultation. So with this, you don't have to be scared. We'll give you the basic and the ultimate good visual care that you need. And also try to participate in this Saturday's free eyes training. So please get your eyes checked and live well. Thank you.
Thank you, Dr. Thelma, for the presentation. I'll leave it open for 1 minute to see if there's any questions.
Hello, Dr. Thelma.
Hello, I can hear you. Good afternoon.
So my question is, I noticed that normally when I don't wear glasses, I don't, like, there are some glasses I use for fashion. So when I wear them, I notice pain in my eyes and it itches. So the moment I pull them, it takes a while, then it will calm down, then it will stop. So I was like, is it that my face does not really go well with glasses? Because at times I feel this sharp pain, like light entering my eyes, and it pain, like there's a way the pains come. So most times I just said, okay, let me just get glasses to prevent the sun rays from coming to my eyes, from direct to my eyes directly. But whenever I wear these all of these glasses like that, it keeps paining my eyes, like I get these itches and all of that. So I want to know what that condition is. So that's my question.
Okay, firstly, let's get to that. Most people wear glasses just for fashion, when by they have refractive error. They don't know, they're not aware. When your glasses are not being treated, and you just wear, we call them plano glasses, that's plain glasses, there's no power there. They don't serve purpose for the patient, in the sense that for digital worker, like you said, so you wear it when you want to work and all that. Once those correction those treatment that should be given to those glasses, once they are not there, they won't serve the purpose. And secondly, when you say you see your glasses having some dust particles and it has some stinking, gives you some stinking sensation, people who wear glasses should cultivate the habit of cleaning their glasses. Once you have glasses, you could notice that there's always a wipe that are attached to glasses. So whenever you want to use glasses, you first of all wipe them out, those dust particles. Because when you use glasses, when you're moving, when you're walking on the way, you see that particles of sand or dust lay on the surface of the glasses, and which can cause irritation to a patient. So it's always advisable that you use your glasses cotton pad clean to wipe up before using. So I think with the best application is good. But once you actually have this, once it continues persistently, then it's very advisable for you to see your optometrist. It's very important. So did I answer your question?
Yes, ma'am. Yes, ma'am. Thank you very much, ma'am.
Yes, thank you. Any other question, please?
I don't believe so, Dr. Talmat. So thank you once again for educating us about our eyes and the need to get, to keep healthy eyes and get tested to see if there's any need for wearing glasses. This concludes the presentation for today, but we still have future health talks over the next few weeks as we continue to mark the 50th anniversary of St. Emmanuel Hospital. Thank you for joining us and have a lovely day.
You're welcome.